So my name is Stephanie or Steph Boblooch, and actually I first attended CleftCon virtually in 2020, and thank you, Adina. And I remember attending it from a soccer field because soccer just opened back up for my 3 kids that were desperate for activities, and I participated outdoors wearing a mask. And some of our other families from my program in Baltimore, which I'll talk about a little bit, also joined, and then we had a meeting after, like the Monday after we met, this group of parents and myself, and everybody just felt so empowered. I felt empowered to do my job better. Parents were empowered to create new initiatives. We had an infant and toddler play date come out of it. It was excellent. So that's my experience with CleftCon, and it was fantastic. And so this is much better to be in person, see everybody's faces, be in New York City. So to tell you a little bit about myself, I am a clinical social worker and also the cleft team coordinator or program manager for the Randolph B Capone cleft lip and palate program in Baltimore. So I do have a clinical social work focus, also program management though. So I meet with all of our families to go through treatment plans, scheduling, and I also do help with the psychosocial piece. So our team does not discharge patients after the age of 18 or 21. We see patients from the prenatal period all the way through adulthood. So yes, I'm happy to say that. So that is something that for our program, in my experience, I work with people of all ages. So in this period of transition into young adulthood, and I love this room, I can tell there's just all different ages represented. It's so awesome. But in my role, right around 17 to 21, in that age range, again, I'm a social worker, but also the coordinator. So I'm meeting with everybody that comes in and out of our clinic, regardless of age. So around that 17 to 21 period, that's where in my mind I think, okay, this is the transition period. And this is where we're going to prepare individuals to kind of take over some of their healthcare decisions. So, and I believe it's important that kids at all age-appropriate intervals are involved in their treatment plans, communicating with their doctors, having their voices heard. It's especially important as we go into an adulthood that you feel empowered to take over some of those decisions. So some of that, again, we're talking about having access to records, understanding health literacy. Do you know your medical history? I sometimes see adults that say, you know I had all these surgeries when I was younger, but I don't know at what point or where. So we see some of that. How can we help you access your records? You deserve to have access to that. So having our patients enroll in a patient portal, I'm sure you all have experience with those now, is really important at this stage. And just as from the provider perspective, I'm thinking about health literacy. So, which would be finding, understanding, and using information and services to inform healthcare decisions. So the goal would be that every adult is and feels health literate. I also put on here, knowing how to make appointments. So when there's the transition from like 17 to 18, sometimes the parent is still calling us to schedule appointments, and that's okay. We've known the family for years and years. But sometimes I hear from adults later, and I hear, I wasn't sure how to reach back out and schedule an appointment. I wasn't sure how to find help. So making sure that everybody knows that, because that's really empowering to be able to do that. And so, and a piece here again, like I said, my program is somewhat unique that we see patients from birth through adulthood, but even if you are discharged from your current or previous providers, that you can still seek treatment as an adult later, and you get to be the driver of that. So some of the common treatments for adults, and again, this is not an all-inclusive list, there are other things here, but this is what I see in my work. Often have adult treatment or adult patients returning to talk about dental treatment, and usually is looking for a new provider, a provider that has experience with cleft or orthodontics. With that dental piece too, at least in the area I am in Baltimore, we get a lot of calls of, I'm seeing my dentist, I'm thinking of having some dental work done, but my dentist would like me to see a cleft specialist and make sure it's okay to proceed with my treatment plan. So we do see a lot of that. That's totally reasonable. We'll see a patient and we'll go back and talk to that dentist. Jaw surgery. Not everybody needs this surgery. Commonly this happens between 16 and 18, but for various reasons, sometimes we see patients all the way into their 30s that have not had this surgery yet, but decide, I think I'm ready to do this, or I want to gather all the information to see if I'm ready to do this. Rhinoplasty. Now I put cleft rhinoplasty here because although there is a cosmetic component to it, it is functional. And I encourage this room of adults when talking to your providers that it is a cleft rhinoplasty. It's both. It's both functional and cosmetic if there's something that you want to change. A lip revision is possible as an adult. I do get calls about speech sometimes. Is there anything I can do to improve my speech with therapy or surgery? Hearing testing and treatment, if you remember as a child, was probably very standard in all of your visits, that you would have a hearing test, see the ENT, and then as an adult you're not as regularly followed. Someone's not calling you once a year to remind you to do that. So that's available to you. Psychosocial support as well. You can return to a cleft provider to discuss this. If you're returning to a cleft team, there should always be a social worker or a psychologist available on the team. If there's not somebody available right in that clinic, there should be access to mental health services. And genetics. I feel like this is one of the least common reasons we see adults come back in our program for care as an adult. But you can go directly back to the genetics office to talk about planning for future pregnancies. And I'm sure when we get to discussion too, there are additional things on this list that you might have sought treatment for, you have questions about, and possibly fistulas sometimes open back up in the palate. You can continue to pursue treatment if you wish. And I do tell adult patients this all the time. These treatment decisions or recommendations can change and shift all the time. You may see return to cleft care and come back a year later because you're still deciding what to do or thinking about what you want to do. Something could have changed. But the biggest piece is that you're deciding this now. You're an adult. You get to decide what you want to do. So how do I find quality cleft care? I'm sure have most of you seen both of these websites and search bars. If not, I would recommend that you start here. Both the American Cleft Craniofacial Palate Association and SmileTrain have these amazing search engines where you can type in your address and you will get a listing of teams within specific miles of your home. It will show you who's on that team, what the age range served by that team is, etc. So you can find both of these, and again, you'll get my slides after this, so you'll be able to see that. So that is the first place I tell people to go when looking for care. Again, sometimes you're returning to the same team you might have been seen by as a child, but we're all adults in this room. We move, we change all the time, so that's a great place to start. So I've been saying too and talking about team care. So this was important when you were a child. How many people, just show of hands, were followed by a team? Did you? Okay. Because sometimes, depending on where you live, you're followed by a team or sometimes individual providers. So why is this important? And this is a picture of my team here on World Smile Day that we celebrate at our hospital every year. But I believe this is important even into adulthood. It's more coordinated, cohesive care, kind of like a one-stop shop. And especially if you're an ACPA-approved team, so if you use either the ACPA website or the SmileTrain website to find providers close to your home, If it's an ACPA-approved team, we are required to hold certain standards. There's the parameters of care document. It's available online. It's very transparent. But we are supposed to provide coordination, communication, watch satisfaction for the patients, and provide psychosocial support. And so it's one team of various specialists, and I highlight this, working with you to develop a treatment plan and assist you with follow-up. So when you're an adult, again, you're driving some of those decisions, what you feel like you need, what you're trying to seek out, and your team should be working with you and listening to you. So from my perspective as a provider and a coordinator that schedules appointments, one thing I wanted to share was that, so a lot of you raised your hands that you've been seen by teams in the past. There's a lot of providers, right? Those visits are very long. They can be up to 2 hours long, sometimes longer. And sometimes an adult will call and schedule and say, hey, I want to see everybody. Like, I'm coming to this appointment, I want to see every single person that's on that list. And that's great, we can certainly do that. I have had adults come in and say, hey, I want to see everybody. And at the end of the visit, I've gotten a call, which actually I really appreciate these kind of phone calls. And they've said, hey, you know what, I came in and I didn't think I was going to have to see speech. Was there a problem somebody noted with my speech? And it was certainly not somebody noted a problem with speech, it was just that's our standard workflow. So, and in our team we provide notes in writing to every patient after the visit, and we send that to your primary care provider as well, so that's evident right in the note that it wasn't, you know, somebody saw a concern and sent speech into the room. It's just part of our flow. And I have had people call and say too, my goal is this in the visit. And I love that. And I've started asking, you know, what is your goal? What is your objective in scheduling this appointment with us as an adult, especially if you haven't been seen for a while. And that helps us create even the perfect visit for you. And actually, even this came up last night at dinner. What if there are no cleft teams near me? So we're really lucky in this corridor right here on the East Coast, even in Baltimore. There's a couple teams right in my area. So I do occasionally get calls when people have moved away from the state, and I always suggest you go first. You can go again to the ACPA website, the Smile Train website, find the team that's closest to your home. There should be a coordinator listed, so that's someone like me. They will not mind hearing from you, talking about where you live, what you're looking for, and hopefully helping you connect with other providers. It would not be odd as well to reach out to providers of your past either and ask about, hey, I'm now in this area, I don't know where to go, I'm looking for a dentist. Those are reasonable things to call one of your previous providers for.
Can I add one resource to your list?
Please.
The American Speech Language and Hearing Association, it's called ASHA.org, has a link on it for, it says find a provider. And if you go in there and you type in you want a speech pathologist or you want an audiologist, you go in there and you type what you want, find professional, and then you find your state and then your county or city, well, however they have it divided up depending on where you live. And then if you type in cleft-palate or cleft lip, you're going to get a list, if you're looking, say, for speech, of all the speech pathologists within, say, the Kansas City area that they may or may not be team affiliated, but they have that background.
Right.
Most of them are team affiliated, but as adults trying to find providers, and I get asked this question a lot, is as a speech pathologist, to go in and find yourself. It's not an all-inclusive list because of being a member of ASHA is not mandatory, there's my speech, mandatory for speech pathologists and audiologists across the nation, but it's that best practice, it's that level of expectation, it's the highest level of achievement that you can get within a professional organization. And if you were seeking a provider wouldn't you want somebody that has met that criteria, whether it's
Yes.
for you, your child, whatever.
Yeah.
But if you go in there and you will often find, it'll list pediatric, or it will list, and now it'll list the ages underneath those service providers that they provide services for. And many of them, you'll find adult. So you still have to call them.
Yeah.
But it's a free resource to add, and it's available nationwide.
That's awesome. Yeah, and that's great. And I think, is their website asha.org?
Yes, capital A,
A-
capital S, capital H, capital A.org.
Okay. Yeah, that's excellent. And I would love to hear any of these things too. This is definitely an open dialogue. And we have a document that I have handouts I can share. It's also on our program's website, but I update all of our patient resource documents every couple months. So I'm happy to hear about some of those things that we can list too. That's great.
Thank you.
Thank you.
I have one more thing too on the
Yeah.
list. Is a maxillofacial prosthodontist for adults, because that's where I go now. I had to find on my own,
Yes.
through another prosthodontist.
I'm sure, yes. And I feel like with OMFS too, it's just hard to find OMFS in some areas too, and prosthodontics too. Yeah. Any other resources you want to share with each other? This is great. And again, if you call, even if you're not a patient of that team, you can call those team members listed or those providers listed on those websites and ask for help. You can call me. I might not be as familiar with your area, but you can call me, even if it's just to vent your frustrations over finding someone. So some of the characteristics of a high-quality provider, experience and qualifications, which we all use Google constantly. We all, do research when it comes to our healthcare, so that's obviously important. But listening skills. So we hear all the time, bedside manner. They had excellent bedside manner. But that matters. How a provider is interacting with you. Do you feel listened to? Do you feel respected? That really does matter. And you're your own advocate, so you want to be comfortable with your providers. And again, it's hard to find providers as an adult, but when you do find one, you want to feel comfortable with them too. A focus on your priorities and goals, and I'll go into that a little bit more in terms of kind of the mantra, what matters most. So is that provider listening to you and what you want? And can they explain your treatment recommendations in timelines and ways that you understand? So we've had adult patients return interested in rhinoplasty, and they might learn at a clinic visit, before we get to rhinoplasty, we need to handle this one dental component, right? Sometimes the care is staged in a certain way to be the most effective, but does that provider help you understand why? Or are you just left with, well, now you need to do this before we can do this? That can be disheartening and discouraging. So are the providers able to understand, or to help you understand your own treatment timeline? A willingness to coordinate and communicate with other providers. And it is totally okay for you to ask for this. Release forms are really easy to sign. They're available everywhere. But it is okay to ask for that type of coordination. And like I said, we do see quite a few adults in our clinic that are seeking dental care elsewhere outside of our clinic, which is fine and great. And then the actual dentist or orthodontist asks them to come back to a cleft center for an assessment and evaluation to make sure that the patient can do expansion or crowns. So it's okay to advocate for this and ask for that. And patience. The pandemic kind of it did mess up a lot of things. Timelines were pushed back, it was horrible. I still get a little teary thinking about it, and I just think of a few adults that it's really hard to make these decisions, right? So specific adult finally decided, in their 30s, okay, I'm gonna do it, I'm gonna pursue jaw surgery. Then the pandemic. So it's a lot of time, it's a lot of preparation, it's a lot of thought, it's a lot of stress. Surgery gets scheduled, then got canceled. Did anyone else experience that in this room? No. That was such a hard time to watch these treatment timelines be pushed back in a way that was forced upon people. So some surgeries even changed, right? And now we're past that, we're back open, things are back on track, happening on time. But this particular adult, it took kind of a couple years to come back, and then they came back to see us twice to decide, is this right for me? So finding providers that are patient, because you get to decide what you want to do and when, and that's really important. And again, now things can be scheduled, at least in most places, on time. And a challenge I hear too, and I get this occasionally, that you could return to cleft care after many years, haven't seen a team in 5-10 years, and then especially if you're going back to a place that you were familiar with when you were younger, and then there's different people there. So just acknowledging that happens, that can be challenging, that can be really hard. So questions to ask yourself when looking at cleft care or going into an appointment. And I mentioned this a little bit ago, but what matters most? And we're starting to hear this more in healthcare, and I'm so glad that we are. This came up a few times at the last ACPA meeting too. So why does this particular thing matter to you? And why does it matter in this specific time of my life? So quality of life, improved speech, change in facial appearance, improved self-esteem, etc. What is it that matters to you, and what are you seeking out? And what are your goals? And this is where that psychosocial support component comes in, and I tell people all the time, whether they're in the prenatal period or adult period, but doing this without help is not easy. So I recommend everybody have psychosocial support. So a team social worker, psychologist, or a counselor can help with this. If you're pursuing some type of treatment, what are my expectations of the treatment, and what are my provider's outcomes, and or expected outcomes? And how does that match up? How does that vibe together? Am I ready to start treatment? Again, I talked in the last slide about how the pandemic kind of threw everything off and just made it hard to plan treatment. But you can go see your providers, and they can recommend whatever it might be that they recommend for you, or you can go to gain information about a possible next treatment. But if you're not ready to do it, then you don't have to do it. Or you can come back and talk to somebody a year later or 2 years later. You get to decide. I hear all the time as well from parents or from adult patients. So I went to a visit, it was 2 hours long, it was a ton of information, I'm really confused, I got home and I had no clue who to call. So I never want anyone to feel that way when they leave an appointment with us, but that's just a piece to take with you when you go to an appointment, to remember to leave. Do I know what to do next if I decide to do anything next? Is someone going to call me? Do I need to call somebody? This is, kind of old school, but I guess not if it's a tablet, but I love to bring notebooks and pens everywhere. So bring a notebook, bring a pen. Bring a friend to an appointment if you want, a family member, a friend. That was another thing with, again, I mentioned the pandemic, no visitors, so many people alone in appointments was not great. If you are seeing a cleft team, you can ask the social worker or the team psychologist as well to sit in with you on conversations with your providers. That can be helpful if you're worried about expressing your concerns. Possibly you had a bad experience and you want to talk about that. That person can be helpful. I'm not going to talk a whole lot about this because there's a session at 3 o'clock about navigating insurance. But I do want to acknowledge that paying for treatment as an adult is really tricky. This is really stressful. This is new. And even learning the terminology of insurance plans, do you remember the first time you had to figure out what a deductible was? I remember doing that, getting my first job. What's a deductible? How much is this going to cost? So these are real things. I think the session later today will be awesome about that. But if you are seeing cleft providers or a cleft team, they will be able to help you navigate some of this as well. So all of this to me is related. Psychosocial support is so important for so many reasons. But confidence and self-esteem can be tied to as well to a sense of control in your life. So do you feel like you are in a place that you want to be? If you're not in a place that you want to be, do you feel like you know how to maybe move forward? And this is correlated to cleft treatment as well. Making difficult decisions about a treatment plan. So decision-making is a process. Everybody always says, decision-making process. You have to collect information and look at it and assess it. Say, is this the right thing for me to do? If you're deciding on possibly jaw surgery or more orthodontics, right? Something like that. How does this fit into my life? Do I have time to recover? All of those things. It can be helpful to talk to a therapist about that. Preparing for surgery as an adult. I'm sure several of you, if not more, have had surgery as an adult. It's a different experience. It can be more stressful because there's trauma from your past as well. So having help and support to prepare for that will be great. Thoughts and perceptions about oneself that affect behaviors. So that's a piece that a lot of therapists talk about, so that's just the social worker in me, but are there things that you're struggling with that you might not even know you're struggling with that are affecting your behaviors, affecting your social life, affecting your confidence or your self-esteem? And that can be tied into cleft care as well. General emotional well-being. We all know as an adults when we go to appointments now, we get surveys, right? Like they may be related to anxiety or depression, but at least our team, those do get sent out to adult patients. They come to me. We're checking in, seeing how the total person is doing, because mental health is health. Having realistic goals and knowing what your provider's outcomes are and how that matches up, if that makes sense. So if you're going for a lip revision or a rhinoplasty, you might have this expectation and not even realize it. Like it's going to be perfect, it's going to look like this. Your provider hopefully is honest, like I think we can get this result, we might see this afterwards, but that's a tough place to be in. And how am I gonna cope with that after surgery if it's not exactly how I thought it might be? And again, I'm also the social worker on the team, so to me, health is also just all of the other aspects. So financial resources, transportation, etc. So anything that could be a barrier to care, that's why psychosocial support could be important. It's okay to ask for help. Especially, again, the financial piece is really tricky. It's really hard after you pass the age of 18, even with insurance for cleft care. It should not be that way, but it is. And again, so you are not alone. And I think I just love this conference. This is so amazing to be in person with everybody. This is what I tell all of my patients from the prenatal period on. And I never want it to feel like lip service, because you're not alone. So being here, seeing everybody be together, like this is exactly what I mean. And I'll talk about, this is one of my patient volunteers, Paula. She's awesome, I wish she was here. But it's so important to find community. You can look for community within your cleft team if you have that within your providers. Some hospitals have patient family advisory councils, much like the Smile Train does as well, that can be joined. Our hospital does have a cleft-affected PFAC as well. I think Dina is in the room. My Face runs a virtual support group for adults. So anyone can join from all over the country, and I believe other countries sometimes come in. So, and I tell our patients all the time that even if you just log in one time, just to know that there are other individuals, there are other adults that have a cleft, that are struggling with some of the same things that you are, that's available. And again, the Cleft Community Advisory Council is so awesome on a national level. And you can also reach out to the ACPA. And actually, there's a document on the ACPA website, I don't know if you've seen it, but it's cleft treatment for adults. And it even has a portion about how critical adults can be in the lives of other younger kids or new parents that have a child with a cleft. And I see this a lot in my work. I really do. And so again, this is Paula. Paula came to see us several years ago for a dental question. Right after the visit, she sent me an email and said, here's a little bit about my background. I've been reading about self-esteem and confidence in teens and kids, and I really want to be around. So Paula comes to every single cleft clinic we have. She knocks on every patient's door. She delivers parking passes, toys. Just having her around is amazing. So again, we do prenatal consults too, and Paula will knock on the door. She doesn't even have to say anything. She's just there, and that matters. So claiming the power in your story, and difficult things can be really powerful things, and you can give back through that. And I think that's one of the most powerful ways I see our adult patients can give back and reach back. Or how many times I hear an 8-year-old or a 9-year-old say, I just wish I knew someone that was older than me that would tell me this was okay, that they got through it and they're okay. But your story really matters. And it's, as a provider standing up here, it's just totally invaluable when we have partners come alongside with us. So, and it can be hard to accept your journey and see that value in it, but it is valuable. And you are a role model. But really, I wanted to leave you with this, and Paula did give me this permission to share this. But she's fantastic. My contact is up here. I have cards, and truly, I hope that we do have time for a discussion.
Yes.
So that is what I'm most excited about. But again, I'm in Baltimore, but you can reach out to me for sure. Email, phone. You can have my cell phone if you want. I also appreciate feedback in terms of more resources or experiences you might have had too.